Today I'm going to talk about a condition called GERD, otherwise called as gastroesophageal reflux disease. It is one of the commonest yet difficult condition to cure, and millions of people are suffering with this condition, and these people think that the disease is because of excessive secretion of acid in the stomach, or they think that they take some wrong food so that they get the problem, but indeed the problem is different. So I'm going to give you a different perspective of this condition because I'm a physiotherapist. I deal with a lot of neck pain and the back pain. So my patients who are coming to me with the cervical spondylitis and other neck related symptoms are as well will be having the gastric related disorders. It's because the diaphragm, which is the breathing muscle in the body, which is helping for your normal breathing process, is indeed governed by a nerve called phrenic nerve, and this phrenic nerve has the supply coming from the cervical spine. The C3, C4, C5 is the level where the phrenic nerve roots come out, and then they form the phrenic nerve, and that phrenic nerve come down all the way to the diaphragm and supplies the diaphragm. Thereby it helps in the normal breathing process. Now if this nerve doesn't supply the diaphragm properly because of some irritation of the nerve here or because of some nerve compression in the cervical level, the nerve will not be able to pass orders to the diaphragm. Thereby the diaphragmatic tone will come down. When the diaphragmatic tone comes down, because the diaphragmatic tone is important for the tone of the lower esophageal sphincter. What is lower esophageal sphincter? It's like a valve that is present at the junction of esophagus and the stomach. It's a functional valve. It is not an anatomical valve. A functional valve needs external support to maintain its integrity. Remember, whenever you eat the food goes into the stomach. Once the food goes into the stomach, the valve, the lower esophageal sphincter valve must close tightly. Thereby, when the stomach is digesting the food, it should not go up. Whereas people who are having problem with the neck, whose phrenic nerve is affected, the diaphragm will not be able to maintain the integrity of the valve. The diaphragmatic tone is important for the tone of the lower esophageal sphincter. If the sphincter has to function normally, the diaphragm has to function normally. Since the diaphragm is already affected in these people who are having the phrenic nerve problem, the diaphragm will be loose, and that's also the reason why some of these patients will take long breaths like that on and off. You test them in their lungs, everything will be normal, but still they'll be having constant dyspnea, or they have a tendency to take long breaths every now and then as if they are trying to catch breath. So this is also one of the signs of the phrenic nerve disturbances at the cervical level, and this one factor nobody will address. They all think that they have a problem in the lung, or they are having less energy or something like that. So when you have a dyspneic episode without any other true lung reasons, think that you have a neck problem wherein the phrenic nerve, which is supplying the diaphragm, is affected at the root level at the cervical spine. So you need to treat the cervical spine when you want to address the cervicogenic dyspnea as well as the GERD. So the real treatment for the GERD is not to modify the food content, not to change the timing of the food, not to take antacids or other proton pump inhibitors. They are not going to address the lower esophageal sphincter. They are going to only suppress the symptoms. If you want to address the problem, you have to correct the cervical spine, thereby relieve the nerve pressure at the cervical spine. Once a nerve is conducting the messages normally to the diaphragm, the diaphragmatic tone improves, thereby the esophageal tone improves, then the food content will not go up. And oftentimes my patients, they'll be using 2 pillows or 3 pillows to sleep, thinking that when they use 3 pillows, the food cannot easily come up. It's a coping strategy. It is not going to cure the problem. In fact, if you use 2 or 3 pillows, you are going to disturb the cervical spine even more. Thereby you cause more disturbance to the nerve, because when the neck is moving front and front by using 2 or 3 pillows, you are going to cause more damage to the C3, C4, C5 nerve, thereby the condition worsens. So if you have a strategy of using 3 pillows when you are having GERD, you are actually doing a wrong thing. You have to rather use less pillows or no pillow, thereby the neck gets better, and then the impulses can go to the diaphragm normally. So if you have a GERD, address the cervical spine, do the posture correction exercises, maintain the curve of the cervical spine, do the curve correction exercises so that the disc which is disturbing the nerve will no longer disturb the nerve, thereby the tone of the esophageal sphincter will get better. Then in long run the gastric will disappear. In fact, one of the silent symptom of cervical spondylitis is GERD, sometimes burping and belching, and even your cervicogenic dyspnea. So this is what I want to say. If you are having cervical spondylitis, you may have other organ symptoms like this. The same is applicable to symptoms like bloating and belching, which is very easily corrected if you are addressing the cervical spine. I hope you learned something new today. Thank you.